Greetings to you lovely people of Ghana and beyond. This is your teacher Frank Yeboah. Today I'm going to educate you people on prostate cancer. But today we will look at the first part. We're going to look at causes and symptoms of prostate cancer. And someone may ask, what are some of the causes of prostate cancer? Actually, the main cause of prostate cancer is not known, but there are some factors that's normally attributed to prostate cancer, and age is one factor. Age is one factor. Why are we saying age is one factor? Studies have shown that men above 50 years, 60% of them get prostate cancer. 60% of them get prostate cancer. And the above 50 plus, 65 thereabout, get prostate cancer. So age, as you are growing, then there are certain things that happen in your system that cause prostate cancer. And also there are some cells in the testicles that may be damaged, and that one too can cause prostate cancer. That is why people or men who have gotten testicular cancer and their testicles have been removed don't normally get BPH. BPH, that is benign prostatic hyperplasia. Benign prostatic hyperplasia, that is the prostate cancer. Those people whose testicles have been removed as a result of testicular cancer don't normally have prostate cancer. So when this tells us that when there is a problem with the testicle, you can also have what we call prostate cancer. And apart from the age, we have certain factors. And let's look at battery manufacturers, rubber workers, welders, and people who are exposed to metal cadmium also get prostate cancer. Probability of they getting prostate cancer is very high. It's very high. And also too much intake of calcium. Too much intake of calcium can let you have prostate cancer. And also height. Height can also be a factor. And then that of apart from height, we have high body mass index. High body mass index. So I think if your body is too heavy or you are too heavy, that is obese, I think that one too you can get prostate cancer. So all these are some of the factors. And also race. For instance, the American African race. American African people also have prostate cancer because of their race or their ethnic background. And also positive life or family history. Positive family history can also let you have prostate cancer. That is, if your family people, some people in your family, or let's say you have genes, in your genes, in your family, there is prostate cancer in your family, and probability of you having a prostate cancer is very great. So these are some of the causes of prostate cancer, but the actual cause is not known. The actual cause is not known. Okay, now that we have known causes of prostate cancer, let's look at some of the symptoms. What are some of the symptoms that will determine that someone is having a prostate cancer or not? 1, frequent urination, most especially at night. If you get up and you urinate frequently, then it means maybe you have prostate cancer. That is some of the signs or symptoms. And also, when difficulty in emptying the bladder. Sometimes when you urinate and you find it difficult to empty the bladder, after urination, you feel like there is some urine in the penis, then it means you have prostate cancer. It's a sign or a warning that shows that you have what? Cancer or prostate cancer. And also, when you have pains in urinating, when you are urinating, you have pain, you feel pain, some sort of burning sensation in your urine or in your penis, it means you have prostate cancer. You have prostate cancer. And also, blood in your urine, it means you have prostate cancer. So sometimes we know that there are this sickness called bilharzia. There's some bacteria that normally get them in rivers or streams. When we swim open rivers or streams, you normally get a sickness called bilharzia. After urinating, you will see blood. Well, I'm not talking about that one, but this one, sometimes you see blood in your urine. Bilharzia, after urinating, that you see blood. But for this one, for the sign of prostate cancer, that's one, as you are urinating, you see blood in it, or blood in your semen. That is after maybe sex, you see, and then you are releasing the semen. You see blood in it. That it means you have prostate cancer. Prostate cancer. What are some of the signs again? Also, when we have talked about that one, that of frequent urination, we've talked of difficulty in urinating, we talk of pains or difficulty in emptying the bladder. All these are some of the signs of what? Prostate cancer. And also, painful ejaculation. So if you're a man and then after sex and you're ejaculating and you feel pain, then it means you have prostate cancer. It's one of the signs. We all know that after during sex and then you're ejaculating, that one you need to feel some sort of relief. But this one, if you feel pains in it, and it means probability of you having prostate cancer is very great. It's very great. So all these signs, though it may not mean that you have it, but there are some of the signs that will tell you that you are getting prostate cancer or BPH. And when it happens like that, you know what to do. You know what to do. You know what to do. And like I said, it happens 50 plus. And now even age 40, you can have it. Age 40, you can have it. Because of the food that we normally eat, you can have it. You can have it. So all these are signs that will determine that you are having a prostate cancer. You are having a prostate cancer. And then when it happens like that, you know what to do. You know what to do. You know what to do. So today we have seen causes of prostate cancer. We have seen causes of prostate cancer, and we have seen signs or symptoms of prostate cancer. Symptoms of prostate cancer. When it happens like that, when you at least even one or two signs you feel it, then my brother, you better go to the hospital for checkup. You better go to the hospital for checkup. Why I'm doing this video is that now prostate cancer is killing people. It's killing people. Lot of men are dying as a result of what? Prostate cancer. And even why I'm doing this video is that I watched a video on one of these television. An old man about 75 years came to the TV station for people to be solicited for fund to do surgery for him because he is having a prostate cancer. And when he went, the doctors, after thorough investigations and then diagnosed and then examinations, they told the old man that they are going to remove the testicles because he has gotten what we call testicular cancer. He said, no. He told the host, the people who solicited fund for, that he will not be operated. He will not allow them to do the surgery. You know what he said? He said he has wife, or he has a wife. This thing may sound funny, but it's not funny. For to be alive and then they will take your testicle, it's not easy. So I'm doing this video so that if you are watching or if you watch this video and you're having these signs, please see your doctor. See your doctor. Don't go and buy medicine and say you are treating. Please do the needful. Do the needful. And my next video, I'm going to talk about what to do if we have it, and if we don't have it, how to prevent it from getting it. So like I've been saying, as your teacher, Frankie Eboa, I'm going to educate you people, give you information about people, health, anything that will let my viewers be okay. I'm ever ready to do. So as I used to say, if you like this video, subscribe, and it will give me the edge, the flair to do more videos. Until that, Then, goodbye.